Hello, everyone. My name is Lucas Soto. I'm Global Product Manager for Reproduction. And on behalf of Vetoquinol, I'd like to welcome you all to the first Repro 360 webinar entitled Superstimulation in Cattle for in vivo in vitro embryo production. Before we start, I wanted to provide a few instructions. You'll have the opportunity to post your questions in the bar in the right corner of your screen. At the end of both of presentation today, we will take some of the questions to be answered by our guest speakers. For questions not immediately answered due to time constraints, we'll respond by email afterwards. We'll also find a poll in the right corner of your screen that we kindly ask you to respond those. With more than 25 years in the marketplace, Folltropin is at the forefront of Vetoquinol global leadership in superstimulation market. On this demanding and growing market, our aim is to work together to improve reproduction efficiency for both in vivo and vitro techniques. Today is a very special occasion as we have the pleasure of hosting two global acknowledged experts in the field of embryo transfer. Our first speaker, Dr. Ruben Mapletov, has received his DVM from the University of Guelph and his Master's of Science and PhD from the University of Wisconsin. Retired in 2013 as Distinguished Professor Emeritus, Dr. Mapletov has been active in research in reproductive biology and the application of assisted reproductive technologies in cattle for more than 45 years. He has given over 250 invited lectures in more than 40 countries and has conducted embryo transfer workshops around the world for more than 40 years. He has contributed with more than 300 published abstracts and conference proceedings and authored more than 175 refereed publications in scientific journals. Dr. Mapletov is the past president of International Embryo Technology Society and founding president of the Canadian Embryos Transfers Association. He was chairman of the Import-Export Committee of the IELTS for 10 years, and he has been member of the CETA Certification Commission since its inception. Our second speaker, Dr. Gabriel Bo, is the president of the Instituto de Reproducción Animal in Córdoba and professor of the University of Nacional de Villa Maria in Córdoba, Argentina. Dr. Bo received his DVM in Argentina and his master's of veterinary science and PhD degrees in the University of Saskatchewan, Canada. And he's been working for many years on applied research and commercial application of fixed time insemination, artificial insemination, and embryo technology. And he has lectured in numerous courses on advanced reproduction technology and delivered lectures across many countries in the world. Dr. Bo has published over 130 manuscript and referred journal and book chapters, more than 200 invited reviews, and over 470 abstracts and conference proceedings in venues around the world. Dr. Bo has obtained several awards like the Taurus Award in Argentina, the IELTS Distinguished Service Award, the Scientist of the Year Award, SBTA Brazil, and he has recently named member of the National Academy of Agricultural Veterinary Sciences of Argentina, honorary member of American College of Theriogenologists in the USA. And finally, Dr. Bo is the recipient of the 2020 CIMET Prize for Assisted Reproduction given by the International Congress of Animal Reproduction. The prize, which is the most prestigious award in animal reproduction and one of the largest of its kind, it was given for the pioneer effort of Dr. Gabriel Bo for developing practical protocols for fixed time DI, insemination, superovulation in embryo transfer in cattle. I wish to extend my sincere appreciation to Dr. Bo and Dr. Mapletov, and also to all of you for attending this webinar. So with no further delays, I will invite Dr. Mapletov to start off of this event with his presentation. Thank you, everyone.
Thank you, Lucas. Good afternoon. In the very short time I have, I want to review some of the factors that affect superovulation in cattle. But I want to point out in the beginning that I'm going to concentrate on the in vivo production of embryos in cattle, but some of the information I provide will be useful as Dr. Bowe presents the in vitro production of embryos in cows in the second talk. Now, the factors that I intend to cover today are gonadotropin preparations, and in particular, I want to talk about FSH and LH activity. The second point I want to cover is antral follicle counts and how this affects superovulatory response. Thirdly, the day of the cycle in which treatments are initiated and how we can manipulate the cycle in order to accomplish this. The fourth point I want to cover is very briefly is different treatment protocols. And then finally, I want to review some of our more recent work on single and double injection protocols because this will have application to what Dr. Bowe is talking about later as well. Now, when we talk about gonadotropins used for superovulation, we really have two basic classes. One is pregnant mare serum gonadotropin, or as it's now called, equine chorionic gonadotropin. It has a very long half-life, so a single intramuscular injection is all that is required to induce superovulation. However, this long half-life creates a problem. The ovaries are stimulated long beyond the time that the donor cow shows heat. So at the time of embryo collection, you have large unovulated follicles, high estradiol levels, mucus and uterine tone, and often poor embryo quality. The most common gonadotropins used to induce superovulation in the cow are pituitary extracts containing FSH. Now, pituitary FSH has a very short half-life, approximately 5 hours, and so multiple intramuscular injections are required to induce superovulation. Normally, twice daily injections of FSH over 4 or 5 days are used to induce superovulation. The last one I want to mention is recombinant FSH products. These are under development. The half-life can be manipulated through the recombinant technology. Now, to my knowledge, none of these products are registered, and so I'm not going to talk about them any further. Now, some of the earliest work on FSH-LH ratios and superovulation was done in France. Chupin presented these data in 1984. In this particular study, he kept the dose of FSH in 3 groups constant. But what he did was decrease the luteinizing hormone concentration. So he went from a ratio of 0.1 to a ratio of 8.7. In other words, in the first group, he had about 10 times as much LH as he did in the last group. And he found that as he increased the FSH to LH ratio, he increased superovulatory response and he increased the numbers of transferable embryos. Well, this really caught our attention, and we began work on this in the late 1980s. This is a study where we looked at different concentrations of LH in FSH preparations. Our first group was what we called 100% LH. It's a crude pituitary extract. It would be approximately equal to FSHP sold by shearing that was being used to induce superovulation in cattle at that time. And then we began to remove LH. In the second group, we removed 68% of the LH. In the third group, we removed 84% of the LH, or we had 16% LH in the preparation. And then in the fourth group, we had what we called pure FSH. In fact, we couldn't make it pure. We still ended up with about 2% LH in the preparation. The real point here is that with the 16% LH and the pure FSH, we had a significantly greater superovulatory response than we did in the other 2 groups where the concentration of LH was greater. We also had more total ovum embryos collected and tended to have more fertilized and transferable embryos. So because the purified FSH was so costly to produce, we decided then to concentrate on the 16% LH preparation, and this ultimately became Folltropin, which is on the market today. Now, I want to talk very shortly about treatment protocols with Folltropin. And before I do, I want to point out that each bottle of Folltropin contains 400 milligrams NIH FSH P1 or 700 international units of FSH. Now, the first protocol I want to discuss is a 4-day decreasing dose schedule. You can see that we started treatment mid-cycle and we injected 80 milligrams of Folltropin twice daily on that first day. On the second day, we dropped to 60 milligrams twice daily, then 40 milligrams, and then 20 milligrams. On the third day of treatment, we administered prostaglandin, and thus this is a 4-day treatment protocol. Estrus occurs approximately 48 hours after prostaglandin, and artificial insemination is done 12 and 24 hours later. Now, the 5-day protocol is exactly the same, except we delay the administration of prostaglandin by 1 day. So we treat with Folltropin for 1 additional day, reducing the amount in each injection by a corresponding amount so that we still give the same total dose of Folltropin. The constant dose protocols are those in which we inject the same amount of Folltropin in each injection. So if we go back to the 4-day protocol, we'd be injecting 50 milligrams twice daily for 4 days. If we go to the 5-day constant dose protocol, we'd be injecting 40 milligrams twice daily over 5 days. The important issue is, though, that when we compared all of these protocols, we found no significant difference in superovulatory response or ova embryo production. So just because your protocol is not necessarily the same as someone else's, it doesn't mean that it's wrong. All protocols more or less work the same. Now, having said that, I'm going to talk very briefly later on about unovulated follicles. And if ovulation is a problem, you may not be getting follicles large enough to acquire the capacity to ovulate. And so a 5 or a 6-day protocol might very well work better under those circumstances. I want to talk now about antral follicle counts within the ovary, or the proxy that is used for antral follicle counts, serum levels of anti-Mullerian hormone. Now, anti-Mullerian hormone is produced by the granulosa cells in the wall of the follicle. So if we look at an ovary, we basically have 3 classes of follicles. The first one is small preantral follicles, often referred to as ovarian reserve. Lots of follicles, very little in the way of granulosa cells. So these small follicles will not produce much anti-Mullerian hormone. Another class of follicles are the large antral follicles, the pre-ovulatory follicles. These follicles have lots of granulosa cells, but the numbers of follicles are very small, and so they only produce a small amount of anti-Mullerian hormone. And finally, then, the small antral follicles within the ovary. They're very numerous. They have lots of granulosa cells, and they produce lots of anti-Mullerian hormone. So anti-Mullerian hormone levels in the circulation then provides a real proxy for doing ultrasound antral follicle counts. Now, I want to talk about how this affects superovulatory response. Follicle numbers in the cow vary, but they are very consistent within cows. Jaswant Singh in our lab showed that the numbers of follicles at the end of a superstimulatory treatment protocol correlated with the number of follicles recruited into the same or the preceding wave. In other words, the numbers of follicles present at the time of follicular wave emergence was very predictive of the superovulatory response. Now, Ward and Ireland and others have done something similar. They showed that antral follicle numbers had a profound effect on superovulatory response and ova embryo production. In the study referred to here, they divided heifers into two groups. One they call low antral follicle counts, less than 15 follicles within the ovary, and the other high antral follicle counts, more than 25 antral follicles within the ovary. And they found that they had a significantly greater superovulatory response in the high antral follicle group, and they produced more ova and embryos. Now, what about the day on which FSH treatments are initiated? This is a study that we did in the 1980s before we knew about follicular wave dynamics. We initiated treatment in cows on day 3, day 6, day 9, and day 12 of the estrus cycle. And you can see that when we initiated treatment on day 9, we induced a greater superovulatory response, and we produced more total ova embryos fertilized and tended to produce more transferable embryos. Now let's go to follicular wave dynamics and see if we can explain this experiment. This is a two-wave cow. We have estrus on the left and ovulation, estrus and ovulation on the right. Because it's a two-wave cow, the interovulatory interval is about 18 days. If we go back to the beginning then, as ovulation occurs, FSH surges. This FSH surge is responsible for the emergence of the first follicular wave. The follicles within that wave grow together for 2 or 3 days, and then they begin to produce estradiol and inhibin, which suppress FSH-dependent follicles. The dominant follicle continues to grow, though, and it eventually reaches a static phase. That dominant follicle is capable of going on to ovulate, but luteal phase levels of progesterone prevent this, so it eventually undergoes atresia. When that dominant follicle begins to regress, FSH again surges. And as a result, the second follicular wave emerges. And the same thing happens over again. In two-wave animals, then the dominant follicle of that second wave ends up being the ovulatory follicle. Now, if we go back to the experiment that I just described, when we initiate treatment on day 3, we're doing so after dominant follicle selection. So the subordinate follicles are undergoing atresia and incapable of responding to exogenous FSH. When we initiate treatment on day 12, we're basically doing it at the same time, especially if we are talking about 3-wave cows. But follicle selection is taking place, subordinate follicles are being suppressed, and so superovulatory response is also being depressed. When we initiate treatment on day 6, it's at a time of maximum dominance of the dominant follicle. Subordinate follicles have undergone atresia. There are very few follicles available that can respond to exogenous FSH. Now, when we initiate treatment on day 9 in that experiment, you can see this is just before follicular wave emergence in 2-wave cows. In 3-wave cows, that would be exactly at the time of follicular wave emergence. And indeed, many practitioners now who use the estrus cycle as a means of deciding when to initiate superstimulatory treatments will go 9 or 10 days after estrus in order to capture emergence of that second follicular wave. We've gone and looked at this in more detail, looking at the exact time of follicular wave emergence utilizing ultrasonography. And we, in this experiment, initiated treatment the day before, the day of, or 1 or 2 days after follicular wave emergence. And you can see then that when we initiated treatment the day before or the day of follicular wave emergence, we had a greater follicular response. However, it was only when we initiated treatment on the day of follicular wave emergence that we had a greater ovulatory response. Now, I mentioned to you earlier about lengthened superstimulatory protocols. We have now shown that in that first group, the initiation of treatment the day before follicular wave emergence, if we used a 5 or 6 day superstimulatory protocol, we can actually cause those follicles to reach an ovulatory size and ovulate. But that's a subject for another presentation. Alternatively, follicular wave emergence can be synchronized for superstimulation. One of the most effective means is follicular ablation. If you ablate all of the follicles within the ovary, you will have a new wave emerging in approximately 1.5 days. And superstimulatory treatments can be initiated at that time. The problem is that it requires sophisticated equipment and ultrasonography, so it's difficult to do in the field. However, OPU requires exactly the same treatment or the same equipment. And so OPU is often used as a means to synchronize follicular wave emergence for superstimulation for in vitro embryo production or in vivo embryo production. Another method of synchronizing follicular wave emergence is the use of estradiol in progestin-treated animals. This will result in follicular wave emergence approximately 4 days later. It's very efficacious, but the problem is that estradiol is not available in many countries, and this is especially true in Europe, and so I will not pursue it any further. The final method is the use of gonadotropin releasing hormone. Now, this is used most commonly in the USA to synchronize follicular wave emergence for superovulation or estrous synchronization. If the administration of GnRH induces ovulation, a new wave will emerge in approximately 2 days. Now, the problem is there is considerable variability because there's not always a follicle available to respond to an LH surge. In fact, it's probably at random stages of the cycle, only about 60% of animals will actually ovulate in response to a GnRH treatment. So we've developed approaches that we can ensure that we have a responsive follicle at the time of GnRH administration, and perhaps this is something we could discuss further in the questions. But as I indicated earlier, this is the most common approach used in the USA today. I want to change gears now and talk about some of our single administration protocols of Folltropin. This is an experiment that Gabriel Beau conducted while he was in my lab in the 1990s, and he compared a single subcutaneous injection of Folltropin in saline with 8 intramuscular injections administered over 4 days. And if you look at the numbers of ovulations, you can see that there was no significant difference between groups. And there are quite a few animals in this experiment. Now, some of the problems that we encountered in these experiments, I just want to very briefly review. We had comparable results in beef donors, but the response was dependent on the site of injection. We found that the fat pad immediately behind the shoulder provided the most reliable response. Thus, body condition score was important. Animals in the higher body condition scores responded more predictably. Methodology was important. We found that a 1/2-inch needle ensured that we got the injection into the fat pad and not into the muscle overlying the rib cage. volume of the administration, and dose of Folltropin were also critically important. We found it much more difficult to titrate the dose down than with multiple injections. And finally, we had a lower response in dairy donors. We weren't entirely sure why, but we wondered if it was body condition. I will discuss this a bit, just a little bit later. Now, superovulation in Holstein cows, we looked at another approach with the subcutaneous administration, and that was 2 injections of Folltropin rather than the normal 8 injections. In this experiment, we compared multiple intramuscular injections over 4 days, the single subcutaneous injection, or 2 injections where we administered 75% at the time of initiating treatment and 25% 48 hours later at the time that we normally administer the prostaglandin. And if you look at the superovulatory response, again, you can see that the multiple intramuscular injections gave us the greatest superovulatory response, especially when compared to the single subcutaneous injection. However, the 2 injection protocol gave us a greater response that was not significantly different from the multiple intramuscular injections, albeit numerically lower. I mention this protocol because I want to talk about it a little bit later. Because of the inconsistency in results with subcutaneous injections, primarily because of body condition score, we proposed to investigate the intramuscular administration of Folltropin in a single injection. We evaluated the superovulatory response following administration of Folltropin diluted in the polymer hyaluronic acid as a single intramuscular injection. Now, what is hyaluronic acid? It's sometimes called hyaluronin or sodium hyaluronate. It's an anionic, non-sulfated glycosaminoglycan, a polymer of disaccharides that can range in size from 5,000 to 20 million Daltons. It's very common in the reproductive tract of the cow, and it's also used for drug delivery systems with different kinds of drugs. Well, we did several experiments looking at several different concentrations of hyaluronic acid by a single intramuscular injection. And I'm just going to summarize these experiments with the 2% solution of hyaluronic acid. We had 175 cows in a control group that received 8 injections in saline, 178 cows in the 2% hyaluronic acid group that received a single intramuscular injection of Folltropin in 2% hyaluronic acid. If we go directly to the numbers of transferable embryos, you can see there is no significant difference between groups. So in summary then, a single intramuscular injection of Folltropin in 2% hyaluronin induced a high superovulatory response in beef cattle, but 2% hyaluronin was very viscous and difficult to mix with the Folltropin. We looked at 1% hyaluronin. It was less viscous and easier to mix, but it was also less efficacious as a single intramuscular injection. Now, I want to go back to our 2 injection protocol. We hypothesized that 1% hyaluronin would be more efficacious in a 2 injection protocol, 2 intramuscular injections, 48 hours apart, as we had done with Holsteins in the subcutaneous administration of Folltropin. Now, this experiment is quite comprehensive. We had 29 donor cows in a crossover design so that every cow was treated with every treatment. We had a control group that received 8 intramuscular injections in saline over 4 days. We had a 0.5% hyaluronic acid group that received 2 injections 48 hours apart, and we had a 1% hyaluronic acid group that received 2 intramuscular injections 48 hours apart. And again, if we go to the numbers of transferable embryos, there were no differences. In fact, the multiple intramuscular injections in saline resulted in a numerically lower number of transferable embryos. We've seen this previously in other experiments. It seems in some groups of animals that twice daily injections are stressful, and this will have an adverse effect on embryo production. Now, John Hassler and Duncan Hockley did a study with American practitioners. They had a control group, 8 intramuscular injections of Folltropin and saline, or they had a 2 injection protocol with 0.5% hyaluronic acid. A large number of cows, and again, if we go to numbers of transferable embryos, you can see that there was no significant difference. So the 0.5% hyaluronic acid worked in practitioners' hands in the USA. The problem, though, in lactating donor cows, there continued to be inconsistent responses. So at this point in time, we really can't recommend the 2 injection protocol in Holstein donors. In summary, then, gonadotropin preparations with high LH content result in lower superovulatory responses and lower embryo production. In fact, dose is also a critical factor. We looked at high doses of high LH content preparations, and we found that this had a profoundly adverse effect on ova and embryo quality. So the high LH content preparations are not advised for use in superovulation in the cow. Antral follicle counts or anti-Mullerian hormone levels are predictive of superovulatory response and ova embryo production. And many practitioners are using either of these as means of selecting donors for either in vivo or in vitro embryo production. Superstimulatory treatments must be initiated at the time of follicular wave emergence to optimize response. And as I mentioned earlier, most practitioners are synchronizing follicular wave emergence for this purpose today. Various different superstimulatory treatment protocols result in similar superovulatory responses. And finally, 2 injection protocols of Folltropin and 0.5% hyaluronan are efficacious as intramuscular injections for the induction of superovulation in beef cattle. But as I said before, with the results that we have thus far, we cannot recommend use in dairy cattle. I thank you very much for your attention. I turn this then over to Gabriel.
Thank you. Thanks a lot, Dr. Mapletop. So I'd like to invite Dr. Gabriel Baugh. So welcome to the digital stage, and the show is yours. Thank you.
Thank you, Lucas. Can you hear me all right?
Yes, perfectly.
Okay. You see my first slide?
Yes.
Okay. Okay, thank you very much. And thank you, Vetoquinol, for inviting me to give this short presentation and share with you some of the information that was generated on superstimulation for in vitro embryo production. So I'm going to start talking mainly about in vitro embryo production now. And in vitro embryo production has increased greatly in the last few years. And as you can see here, this is the data from the IETS Data Retrieval Committee in the last report from Joao Viana. And as you can see in the dotted line, the number of IVP embryos, so the in vitro produced embryos, has increased. And in 2016 was a turning point in which IVP embryos exceeded the number of in vivo derived embryos produced around the world. There are several reasons for that. Some of the reasons are related to genomics and the application of genomics to detect animals where they are very early in their life and people are trying to reproduce them. And there are also other aspects related to practicality of using IVP in some cases. When we looked at the number of embryos produced around the world, and if we compare in vivo and in vitro production, here you can see in this slide that there's about the same number of embryos produced in beef cows. However, in dairy, there are still more embryos produced by superovulation embryo transfer compared to in vitro. However, if we looked at the number of donors that are on in vitro production, about 85% of the donors are Holsteins. And the main reason is that what I said before, genomics is, now with genomics, we are able to detect the best animals very early in their life, as early as they are born, or we can even do genomics on the embryos to detect which are going to be the best animals to reproduce. And that has a profound effect on the number of in vitro production that is done around the world. Well, breed has an important consideration when we looked at in vitro embryo production. As Ruben pointed out, the number of follicles and MAH is critically important to detect which animals are the best embryo producers. In here, we can see that there are a significant difference in the number of oocytes collected and the number of blastocysts produced when we compare different breeds. And in the top part, we have the Holstein and the Angus cattle, which are the Bos taurus breed. And in the bottom part, we have the Bos indicus cattle. And as you can see, there's a big difference in the number of oocytes that are aspirated, which is related to their follicle population. We know that Bos indicus type of animals have a larger follicle population compared to Bos taurus, and that also impacts on the number of embryos that are produced in vitro. So you see that there's about twice as many embryos produced in vitro in Brahman type of cattle compared to Bos taurus. When we looked at cattle and when we look at individual animals, there's also a great variation, as well as what Ruben has said on superovulation. In vitro embryo production, we now see that we have the same variation between cows that we have seen for many years in superovulation. So one of the postulates that was said many times at the beginning of IVP, that we were going to overcome the problem of the tremendous variability that we have in response, is not the case. And here, as you can see, this is data from Ieda Watanabe from Vitrogen in Brazil, with a large number of donors that were aspirated from 4 different breeds. There is a big variation between some donors and other donors. If you looked at the Holstein breeds, there were cows in which they aspirated around 100 oocytes compared to others in which they aspirated a very low number. There's also another important consideration, and that is repeatability of embryo production. And this was another study that was done by Pietro Baruzelli's group in Brazil, where they aspirated Nelore cows for 12 months. So they did an aspiration every 30 days, and they did 12 consecutive OPU procedures. And they looked at embryo production. They have a difference between the donors that have a higher population, a higher follicle population, and lower follicle population. But then they also looked at the repeatability. So as to say, if we have a donor that produces a large number of embryos, she's going to be producing many embryos over time. And as you can see here, if you look at the number of recovered oocytes that were collected, the repeatability is very high, up to 80%. So it means that if you can identify the best donors, those donors are going to produce most of the embryos in your program. Now, sometimes we need to produce embryos from cows that may not be or may not have a large follicle population. So how can we improve embryo production in those donors, especially if they are very valuable donors due to their genomic profiles? So one way that we can use is use the same tools that were developed for superovulation and embryo transfer, which is synchronizing the follicle wave. And this is the same slide that Ruben showed of the different treatments that we can use prior to superovulation. Pietro Baruselli has also done a study where he looked at breed and also different types of follicular manipulation prior to OPU. In this experiment that was presented at the SBTE meeting, he had a control group in which cows were aspirated at random stages of the erection cycle, so there's no previous synchronization to the OPU procedure. And the other group of animals, they synchronize their follicle wave by giving 2 milligrams of estradiol benzoate and a shot of prostaglandin at the time of insertion of a progesterone releasing device. In this case, we expect to have wave emergence at about 3 or 4 days after the application of estradiol benzoate. They also looked at another group that received estradiol and progesterone, but they were also treated with BST, with the bovine recombinant somatotropin, or another group in which they received a small injection of equine chorionic gonadotropin, 400 units, and that injection was given 2 days before the follicle aspiration. When they looked at groups, they have 3 different types of donors. They have Nelor donors, so Bos indicus, they have Brangus donors, and they have Holstein donors. And in this case, they looked at the number of oocytes that were aspirated. As you can see, there was not a great effect in the Nelor cows, but there was a significant effect in the Brangus cows, in which those that receive ECG produce more oocytes, and anything that you could do with the Holsteins will improve the response. Synchronizing the follicle wave, using the synchronization plus BST, or using the synchronization plus ECG, significantly improve the number of oocytes that were aspirated in the Holstein donors. We have also done other studies in Argentina, in beef cows, where we compare different types of follicle wave synchronization and different types of gonadotropin stimulation. In this case, we compare the use of estradiol and progesterone. In this case, we just injected estradiol and progesterone. We did not use a CEDAR device. And cows were given ECG 4 days later, and the OPU was done at 72 hours. In another group, instead of using ECG, we use 4 injections of Folltropin. So we gave the injections twice daily for 2 days, equal doses. And then we have 2 groups in which the follicle wave manipulation was done by dominant follicle removal. So we aspirated the 2 largest follicles 1.5 days prior to the injection of ECG or to the administration of Folltropin, again by twice daily injections for 4 days. We have a coasting period at about 36 hours before we did the OPU. When we compare in this, we looked at the results, there were no effect on type of follicle wave manipulation, so dominant follicle remover or estradiol gave us the same number of oocytes aspirated. When we looked at the treatment with FSH or ECG, in here we have a higher number of follicles aspirated and a higher number of oocytes collected when we use Folltropin. So then we decided to use Folltropin to stimulate our donors prior to OPU. In another study that was done in Brazil, we did this study in collaboration with Pietro Baruselli. Pietro had a graduate student working at the dairy, at 2 dairies in Brazil. These were high-producing dairy cows in Brazil, and he used lactating or non-lactating donors. All the cows received estradiol benzoate and a CEDAR device for 7 days. And half of the animals also received Folltropin, 200 milligrams, so 10 ml of Folltropin divided in 4 injections given every 12 hours, 2.5 ml each injection. And then they left 40 hours between the last FSH to the OPU for a coasting period. When we looked at the results, we looked at the number of follicles aspirated, the distribution of the follicle population, and the number of embryos produced. When we looked at total number of follicles aspirated, there was no significant effect of Folltropin treatment of the number of follicles aspirated. And we have seen this in many other studies. When we look at the distribution of the follicular population, you can clearly see here there was a big change. The number of medium follicles, which are the 6 to 10 millimeters, were significantly increased in the cows that received Folltropin compared to the controls. Whereas in the control groups, there was a significantly higher number of small follicles compared to the Folltropin treated cows. When we looked at the number of blastocysts produced, there was a greater number of blastocysts produced in cows treated with Folltropin, and that was mainly related to a higher blastocyst rate. So in other words, we are producing more embryos using FSH than when we don't use FSH. So we probably aspirate the same number of follicles, but we end up with more embryos at the end of the 7-day period. And this is related to data that was reported by Patrick Blondin some years ago when we looked at follicular diameter and the capacity of the oocytes to produce embryos. And here you can see that if you aspirate 7 to 10 millimeter follicles or follicles that were larger than 10 millimeters, the number of embryos produced or the proportion of embryos produced were significantly increased. Well, the problem when you aspirate very large follicles is that in those very large follicles, the aspiration efficiency is very low. So that's why we, particularly ourselves, we prefer to have these medium-sized follicles, which give us the best embryo production, and we don't have such a significant reduction in the efficiency of oocyte collection. In another study that was done in Brazil, again by Laís Vieira, we compared the use of Folltropin as twice daily injections or as a single injection diluted on hyaluronan. We basically used the preliminary information that was generated by superovulation that Ruben presented in the previous presentation, and we decided to see if we could get the same results by giving a single injection of Folltropin diluted in 0.5% hyaluronan. So basically, all cows were treated with estradiol and a progesterone-releasing device, and then 4 days later, one group of cows received twice daily injections of Folltropin for 2 days, 200 milligrams in total, so half a bottle per cow. And then we have two groups that received either 200 or 300 milligrams of Folltropin diluted in 0.5% hyaluronan. We wanted to look at plasma FSH levels in these cows treated with FSH, and we also looked at in vitro embryo production. Plasma FSH was done in Holstein heifers, and we draw blood from them to analyze plasma concentration of FSH after the injections. And here you see in the blue line, this is the control group in which FSH did not significantly increase over time. Then we have the multiple injections, and this is what you typically see when you treat a cow twice daily. The FSH goes up at 6 hours and then down by 12. Then you give the next injection, up again by 6 and then down by 12, and the next day and the next day. The other two lines, the gray line and the yellow line, were the cows treated with a single injection of Folltropin diluted in hyaluronan. And as you can see here, the cows treated with 300 milligrams of Folltropin gave us a bigger rise or higher concentrations at about 12 hours. And then it went down by about 48 to 60 hours. Whereas the cows treated with the 200 milligrams of Folltropin gave us a peak at about 12 hours again, and then it went down to baseline by 36 to 48 hours. Well, when we looked at these levels, we thought that 300 milligram was going to give us a better response than 200, but it was the opposite. In fact, we got a better response with 200 than 300 milligrams of Folltropin given an IM injection. And we think that this is probably related to a very high peak that we reached that may affect follicular dynamics or follicular development. This is the follicle data at the time of OPU. And as you can see here on the left-hand side, this is the follicular population. And again, as you can see here, there was a higher number of medium-sized follicles in the 3 groups treated with Folltropin compared to the control group. And there was also a significant increase in the large follicles in cows treated with a single injection of FSH. When we look at the follicle population, this is the picture that you see when you're going to do the OPU. So you have about the same number of follicles, although in here it was significantly higher. But the main difference is that we see a very different follicular population. We see many medium-sized follicles compared to the cows that were not treated. When we looked at follicle aspirated, in here, there was a significant increase in the number of follicles aspirated, something that we have not seen in other experiments, but in here, we did have a higher number of follicles aspirated. And then when we looked at the embryo production, as you can see here, the number of viable embryos was significantly higher in the group treated with FSH compared to the control group. If we looked at the group treated with 200 milligrams of Folltropin diluted in hyaluronan, this was the group that gave us the numerically highest response. And when you compare this group to the other that received 300 milligrams, you can see that the number of viable embryos was significantly higher when we use the lower dose. So this means that sometimes a higher dose is not that beneficial to use prior to OPU. Again, we have looked at this same protocol in beef cows. These were Angus donors that were treated in Argentina. We just published this experiment not long ago in Animal Reproduction Science. And in here, we reduced the dose of Folltropin. We used 160 milligrams of Folltropin in 4 ml of 0.5% hyaluronan. And the rest of the protocol was the same. And we used a control group in which the follicular wave emergence was synchronized with estradiol, and they also received a progesterone releasing device, but they did not receive Folltropin. When we looked at the total number of follicle aspirated, the number of viable oocytes aspirated, there was a significantly higher number in the group that were treated with Folltropin compared to the controls, and the number of blastocysts produced were numerically higher in the group treated with Folltropin. So again, we confirm the results that we have seen in Holstein cows. This is another experiment that is yet to be published. That was shared by Daniela Demetrio. She presented this last week at a webinar that was done in the US. And he used the single injection of Folltropin in hyaluronan, except that she used a different protocol, because in the US, estradiol is not allowed to use in food animals. So then she tried to use GnRH 1.5 days before she started treatment with FSH. And then she also used a shorter coasting period. She used the 48 to 52 hours between the injections and the OPU. In our case, we used the 72 hours. She also used a lower dose of FSH that we have used in lactating dairy cows. She used 140 milligrams of Folltropin diluted in 3.5 ml of hyaluronan. Basically, what she did, she diluted the Folltropin with the hyaluronan, and the hyaluronan comes in a 10 ml vial. So you dilute the Folltropin powder with a 10 ml vial of hyaluronan, and then she took 3.5 ml and gave it to each cow. And when we looked at the number of embryos produced, she compared this with a group of lactating cows that were aspirated without any FSH. And you see that the oocytes per donor was not different, again, similar to the study of Vieira, but the number of grade 1 and 2 oocytes, the cleavage rate, the blastocyst rate, and the total embryos produced per OPU, and the grade 1 embryos produced per OPU was significantly greater when she used the single injection of FSH compared to non-FSH. As I said before, There are a lot of prepubertal heifers in OPU programs, especially genomics or very valuable heifers for most of the genetic companies. And there's a great interest to superstimulate these heifers to get the highest number of oocytes produced to produce the highest number of embryos in vitro. This is a study that was done by Pietro Baruzelli in his lab, where they use a CEDAR-G device combined with estradiol benzoate, and then they gave FSH, 4 injections of FSH twice daily for 2 days, and then they left 36 hours of coasting period, did the OPU, and he compared with a group in which the follicular wave was also synchronized with estradiol and progesterone, but the heifers did not receive Folltropin. And when we looked at the results, if we concentrate here on the cleavage, blastocyst rate, and blastocyst produced, the numbers were significantly higher in the group that received Folltropin. Again, Daniela Demetrio, she has recently tested this in prepubertal heifers, and again, she used GnRH 1.5 days prior to the injection of Folltropin. And in here, she either used a 5-injection protocol in which she gave a twice daily injection of Folltropin for 2.5 days, and then she had a shorter coasting period compared to the older cows. The coasting period in here was 18 to 20 hours. And then in another group, she used a single injection of Folltropin. She used 100 milligrams of Folltropin diluted in 2.5 ml of hyaluronan. And then the aspirations were done 44 to 48 hours later. So in the other group, in the other experiment in lactating cows, she used a 48 to 52 hour coasting. In here, she used a 44 to 48 hour coasting between Folltropin and OPU. And here are the results that are going to present at the next ITS meeting. And as you can see here, there was no significant effect of treatment on the number of embryos produced. So giving 1 injection of Folltropin diluted in hyaluronan gave her the same response as the 5 injection. Of course, giving only 1 injection is a lot more practical, and it's a lot easier for the producers to treat these animals prior to OPU. Well, to summarize then, we have seen that the OPU and IVF has become an increasingly important component of bovine embryo transfer technology. We see that the numbers increase every year, especially with the genomics. In both taurus breeds of cattle, oocyte recovery and blastocyst production have been improved by superstimulatory treatments with Folltropin. I would say in some synthetic breeds, we have also seen an improvement as well. So it's not only both taurus. There is a clear evidence that superstimulation increases oocyte and embryo developmental competence and thus blastocyst production. And this is, I think this is the main thing that we have seen when we use Folltropin. Sometimes we get the same number of oocytes aspirated, but then we end up with more embryos in the dish 7 days later. And more recent protocols with a single administration of Folltropin in 0.5% hyaluronan have been very efficacious, making protocols user-friendly while minimizing errors in compliance. It's a lot easier to just give 1 injection of Folltropin that have to ask the farmer to give twice daily injections for 2 or 2.5 days or 3 days. And with that, I thank you very much for your attention, and I'll be glad to answer any questions. Thank you.
Thank you very much, Dr. Bo and Dr. Mapletop. Hello to everyone. Good afternoon. My name is Paul Renaud. I'm technical manager, global technical manager for Vetoquinol, and we will take a few questions that we received in the bar to the right. So the first question that we have is it possible to improve superovulatory response by initiating the protocol 2 days after follicular wave emergence before the deviation and selection of the dominant follicle? Ruben or Gabriel?
Well, I'll answer this because I showed that in the one slide where we looked at initiating treatment the day before, the day of, or 1 or 2 days after follicular wave emergence. And you can, if you remember that slide, you will see that the follicular response was lower when we initiated treatment 1 or 2 days after follicular wave emergence. So despite our ability to observe such, it would seem that selection is already beginning at the time of follicular wave emergence. So we really see no advantage to doing that.
Gabriel, anything you want to add to that, or?
No, I agree 100% with Ruben. I think that 2 days is too long to wait. So you need to start at the exactly time of wave emergence to get the best response.
Okay. The next question, maybe you touched on it in your presentation, Gabriel, but I think this would be a good moment just to review this point. What is the dose of FSH for superstimulation for OPU?
Okay, we normally, in our lab, we normally use half the dose that we would use for superovulation. For example, if it's a Holstein cow that you use a full vial of Folltropin, we use 200 milligrams. If it's an Angus cow that we usually use 300 or 320 milligrams, we will use 150, 160 milligrams. If it's a Bos indicus, because I see here there's a question about dose in Bos taurus and Bos indicus, we use a reduced dose. So for example, if we are going to do an aspiration in a Brangus cow, we usually give 260 milligrams of Folltropin to a Brangus cow, to an adult donor. So we would use 130. So yes, we do reduce the dose when we treat Bos indicus donors.
Mm-hmm. Okay, thank you. Another question, I guess both addressed to Dr. Mapletop and Dr. Bowe. To overcome the uncertainty of GnRH in inducing follicular wave synchronization, whether it will be advantageous to administer GnRH on day 5 or 6 of the cycle and initiate the FSH protocol from day 8. From day 8, the expected day of synchronized follicular wave emergence.
So this is directed towards administering GnRH after dominant follicle selection, and certainly it would work. Really, though, it removes the benefit of synchronizing follicular wave emergence. You're having to observe estrus, wait until you have a dominant follicle, and then administer GnRH. Some people also look at pre-synchronization protocols that are used for estrus synchronization to ensure that they have a LH responsive follicle. Again, this takes a great deal of time and eliminates some of the real benefits of doing this. Now, I'll let Dr. Bowe talk a little bit more about this, but what we prefer to do is to insert a vaginal device so that you prevent ovulation over a period of time and then administer your GnRH. We have found no significant difference in superovulatory response if we administer GnRH from 3 to 7 days after the insertion of a vaginal device.
Okay.
Well, we did an experiment with superovulation, but I presume that this will work well with OPU as well. What we did, we used a progesterone releasing device, and we in that experiment we used Q-mates, which are owned by Vetoquinol, and the Q-mates have 1.56 grams of progesterone, and we gave an injection of prostaglandin on day 0, that's the day of insertion, to get rid of the CL. And by doing that and having low progesterone derived from the device for 7 days, we ended up with many cows having a persistent follicle. Then we inject GnRH 7 days later without removal of the device, so we left the device in place. We got 85% of the donors ovulating to that GnRH, and then superovulation was initiated 1.5 days after GnRH. So I presume that you can do exactly the same with an OPU donor. The interesting thing is that we left the device throughout the protocol, so we did not have to remove the device to induce ovulation with GnRH. And the treatment with GnRH was very effective. We got 85% of the donors ovulated to that GnRH. So I presume you can do the same with OPU. You can give GnRH 7 days after insertion of the device, and then 1.5 days later you start your injections of Folltropin, or give one injection diluted hyaluronan, and then 3 days later you do the OPU.
Okay, I have one last, well, before I go to the last question, I want to remind everyone that there is a poll that we would like you to answer. I think there's 3 questions. It's again to the right-hand side of your screen in that bar. It would be greatly appreciated right after we're done with this last question. So the question that I had, what is the dose? And maybe I'm going to make you repeat here, but I think this is a good question. So when was the OPU scheduled, or when was OPU scheduled to be performed after FSH treatments in the single injection protocol and also the double shot?
Okay, we have here a difference between our protocol and Daniela Demetriou's protocol that was recently published. In our protocol, we give the single injection on day 4 and we aspirate on day 7. So that means 72 hours after the single injection, we did the OPU. In Daniela Demetriou's most recent data, it took her about 48 to 52 hours. So a shorter period, 2 days instead of 3 days between the single injections and OPU. We yet have to do a critical study to look at, compare that 2 or 3 days interval to see which one is the best. I was discussing that with Daniela yesterday, and the reason why she did that is that because she didn't want to avoid very large follicles that are very hard to aspirate. So I think she's probably right, but we need to do the critical study. In both experiments, we produce good embryos and good pregnancies. So I believe that in both cases, we are producing embryos. We just have to see which one is better.
Okay.
The question about 2 injections, we didn't do OPU after a 2 injection protocol, but Gabriel did describe a 4 injection protocol, and your OPU was done approximately 24 hours after the last injection, Gabriel?
36
hours.
Yeah.
I'm going to allow myself to slip one more question in here. And for the other questions that we don't have the time to answer, we're collecting them and we will respond back to you by email. So don't worry, we'll get back to you. So the next question that we had was, what is the ideal interval for 2 consecutive OPUs with FSH stimulation?
Okay, that's a very good question. Most people will aspirate cows every 2 weeks. Having said that, there's a study that was recently done in Brazil where they looked at 2 weeks or 3 weeks or 4 weeks. And in those studies, they was suggested that maybe 21 days is better than 2 weeks. But that was the interesting thing, that study in Brazil was done without stimulation. So I would say what most people do is aspirate those cows every 2 weeks. I will not expect a big problem. The biggest problem that we have with OPU is the same as with normal superovulation. When you have donors being fed for a long time and they are kept in pens and they give a very good ration, especially beef cows, these cows in a short period of time, they get obese. And when they get obese, they become insulin resistant. And when they become insulin resistant, the oocyte quality goes down. So the main thing that we have to keep in mind when we have donors on a superovulation or an OPU, and I have seen the same in both cases, is to try to keep them as lean as possible. Unfortunately, we cannot tell cows to walk down the alley every day, as which some of us try to do, not a lot, but we try to do exercise. But we had to keep an eye on the nutrition. Fat cows or cows that are consuming high energy produce poor embryos.
Thank you. Well, thank you very much, Dr. Bo, Dr. Mapletov. And again, don't forget to fill in the poll. And for those questions that are pending, we will manage to get them out to Dr. Bo and Dr. Mapletov for answer, and we'll get back to you. May I invite back Lucas to give us a closing statement? Thank you, Lucas.
Thank you, Paul. Thank you, both of you, Dr. Mapletop and Dr. Bo. So it's, I think that's a great initiative that we would like to continue for the next next couple of months, and we would like to see your faces again. So it's a pleasure to have everyone here, and please feel free to contact any of us if you have more questions about product and about materials and about anything that we can be helping you, and we would be mostly glad to be on your side. Okay, so thank you, and have a good night or good day, whatever place in the world you are.
Thank you.
Bye-bye.
Bye-bye.